Good morning. My name is Clayton Hamilton, and I'm the Coordinator for Digital Health at the World Health Organization Regional Office for Europe. I'd like to start by thanking the organisers, Scanbalt and the German Federal Ministry of Health, for hosting of this event as part of Germany's presidency of the Council of the European Union. The European Health Dataspace is an exciting and much anticipated initiative that aims to leverage the power of data and digital technologies in improving the health and well-being of populations in the European Union. A common health data space can bring many benefits, including the ability to strengthen international public health surveillance capacity, improve the sustainability of health systems and quality of care, and perhaps most importantly, to enable research and discovery of new health insights and innovations that would otherwise not be possible without the ability to pool data across national borders. COVID-19 has shown us all the importance of having timely access to vital health data to ensure an informed, consistent, and measured health system response to pandemics. Large-scale community transmission of COVID-19 in European member states has had a profound impact on the ability of national health systems and primary healthcare to effectively respond to massive surge scenarios and at the same time maintain continuity in the delivery of essential health services. Shortcomings in even the most well-developed health systems in Europe were readily exposed, and this resulted in an unprecedented call for better use of data and digital technologies to be employed in service delivery and decision-making at all levels of the health system, and for mitigating the associated health and socio-economic impacts which have ensued. In reality, however, we've only really scratched the surface of the capability of fully digitalized learning health systems and digital health services. But we do know that our ability to embrace the transformation that's required to achieve this depends largely upon whether we can leverage data from a variety of sources inside and outside the health sector, and our ability to garner the trust of populations in the safety and security surrounding its use. The European Health Dataspace provides us with an opportunity to address these factors in a way that embodies a recognized set of European rights and ethics principles for the governance and use of health data, that also ensures equity in the sharing of benefits that it will inevitably bring. It is, in many ways, a digital litmus test that can set a standard for cross-border working both in European and in international contexts. But like any new and ambitious undertaking, there are hurdles to be overcome, and we must be particularly cognizant of the public's perception and ensure that they are given an opportunity to contribute to the dialogue that will shape creation of the European Health Dataspace. The creation of a secure data space that allows for research on a range of longitudinal, environmental, genetic, and health systems data is a valuable undertaking. This initiative will be particularly beneficial for small countries to enable them to leverage the benefit of large data sets. However, the European Health Dataspace will only be effective if the data quality and comparability between countries, as well as the interoperability of the data, is taken into consideration. Meaningful value of the European Health Dataspace also mandates alignment of national health data legislation to facilitate cross-border data sharing, and we know that that can take a significant amount of time to achieve. We also need our focus to be kept on developing the capacity of national health information systems, including how they're governed and used, to ensure delivery of a quality baseline of data to the European Health Dataspace. I mentioned before the potential for discovery. Current evidence indicates an enormous untapped potential for the discovery of new clinical, social, and behavioral insights through the combined use of traditional and novel data sources, such as social media and online content, wearables, IoT devices, data from mobile apps, and GPS data, in combination with the application of big data and data science methods. We can use such data, for example, to develop individualized predictive risk evaluation and decision tools for use in primary care settings, which together with novel therapeutics can deliver highly personalized treatment pathways and lead to more efficient and effective usage of our finite health resources. Combining such traditional and novel data sources is also exciting in terms of our capacity to improve the effectiveness of international public health surveillance. We should also consider if we have correctly gauged the public trust in the European health data source concept. The European Agency for Fundamental Rights has recently released a report that indicates that between 1 in 5 and 1 in 4 EU citizens are not willing to share any of their personal data with governments? Will the public be more or less accepting of their health data becoming part of the European Health Dataspace? Can we control consent for individual wishes regarding participation in the European Health Dataspace? These questions and transparency and security will undoubtedly be factors pivotal in gaining public trust for acceptance of the European Health Dataspace. Finally, not all social groups are equally able to harness the potential of digital technologies to combat pandemics. In the WHO European region, national data on household internet access varies from 74% to 87%, with greater variation at subnational levels and between population groups. We cannot afford a digital divide on top of the social and economic divides which exist today. As we say in WHO, we cannot afford to have populations that cannot afford digital health. In conclusion, we're only beginning to understand the many possibilities for leveraging the power of digital health and data to improve health outcomes in different contexts. The challenge, as we move forward with the European Health Dataspace, will be to demonstrate effective use cases, develop a data governance framework, and establish the trust of populations in its creation and use. Striking a balance between investments in wide-scale public health interventions to mitigate the impact of COVID-19 and future pandemics, with investments in digital health systems and services, including the European Health Dataspace, is a shared challenge EU countries are now facing and which we can collectively work together to solve. One thing is clear: the European Health Dataspace is likely to play an important role in many aspects in charting the future of data, digital health, and health innovation in Europe. Thank you, and I wish you a productive and fruitful conference.